Internal resorption is the breakdown of the root or tooth structure occurring from the inside of the tooth pulp going outward towards the tooth or root surface. The chronic inflammation of the still vital dental pulp is associated with this destructive process, which is ultimately related to bacteria making their way into the dental pulp by way of either trauma, decay, or gum disease. For example, bacteria make their way from the gum line where there is an accumulation of plaque and tartar, entering through a recent trauma-associated crack in the tooth and causing a low-grade infection of the pulp tissue. The low-grade infection of the pulp causes the body's natural defense mechanisms to respond with an inflammatory reaction, which leads to a breakdown of the tooth from the inside going out. If the condition is discovered before the perforation of the crown or root canal therapy has a fairly high success rate of saving the tooth.